Hey guys, today I'm going to teach you about what I normally do with people that have something like meniscus injury, where there's kind of a blockage, especially to deep squatting, getting low in a squat. And this kind of pain is often on the inside of the knee, could be outside, even could be the front, but oftentimes it's on one side or the other. And usually it behaves kind of erratically, but generally it's going to bother you as you try to get into a deeper squat, and then it's going to be irritated by overactivity. So the first thing we need to do is get the full motion and mobility back in it, and that'll be this video. And then in the next video, I'll show you some things that I do to progress someone once they get the full motion, some exercises. All right, so let's get after it. First one, especially if it's very painful, if it's kind of acute, this is how I start. So you want to get either sitting or laying down. You're going to put a little towel roll underneath the knee, tuck it in there as tight as you can. It's pretty small, but get it way up in there and then allow your knee to bend. And if that's all you can do, then that's fine. Just stay there, work on that. You can then progress to giving it a little bit of a pull. So you want like pressure on, relief, pressure on, relief. Everything is slow because you want to slowly be able to regain that motion, push any little flap out of the way or anything like that. The other thing I would do is use one hand, but also use the other, because you're going to get a slightly different torque on the knee to make sure you're getting every little bit cleared. So you can do that laying down, or you can just do it sitting in a chair like this, and you're giving that a pull using one arm, then you're switching using that other arm. Good. All right. So that's stage one. Stage two, I'm going to take you over here to a tall surface. And over here, what you're going to do, same concept, but now we've got a little weight going through there. You can start with a towel, tuck it way up under there, and then your goal is to not so much get forward, but think drop down. So you want just a little weight going through the foot, but not much. So you're dropping down. Again, not so much forward yet. Once that feels pretty good, get rid of the towel and then see if you can get it a little further, deeper. You can work this knee a little bit in to out as you go. Right there. Anytime you need to go backwards, just go back to that towel. Now, the next progression, all you're going to do is just get a little lower. So I'm coming back to the bench here. And now, as you're a little bit lower, bring back that towel, start there. Now I've got a lot more weight going through this leg, and that's going to change what's going on at the knee, how it tolerates it. So you're going to kind of go backwards just a little bit, probably. Might be a little more painful. You can work through a little bit of pain, like a 2, 3, maybe 4 out of 10, but not much more than that. Pressure on off. Get rid of that towel. See if you can start to get deeper. And now you can see on this one, I'm getting a little more forward instead of just dropping straight down. My knee is going past my toes as I'm progressing. Okay. Now the last mobility progression is getting all the way to the floor. So what you're going to do here is work to knees and hands right here. You're going to work back into that flexion from here. So you may just be working this motion. Again, if you need to bring back that towel roll, stick it back in there, work on it, and then work to get rid of it. You can also, with this one, shift and roll a little bit. So inside to outside, make sure you're getting that whole motion. Come off of it, slowly back on it. Find that uncomfortable spot, work it, and then come off of it again. All right, so that's going to be your mobility progression. So after you get that full motion, then you can watch this next video and I'll show you how to strengthen that knee and fortify it so you don't have to deal with this again.